Welcome to the Life's Best Medicine podcast, where we are finding hope and healing one episode at a time. No appointment needed, no rubber gloves, and no copay. Just a healthy dose of life lessons to help equip you for this wild journey we call life. Hey everyone, this is a friendly reminder that we are here for entertainment purposes only. We may not even be that entertaining at times, but this is not medical advice. Talk to your doctor, check with your healthcare professionals before making any lifestyle changes or medicine changes. What we're talking about is our clinical experience and what we've seen. And so if you really want our advice, you can consult us. You can actually consult me as a doctor, or you can consult my guest and get all your questions answered. But we can't give free medical advice because we can't pay our bills with that. But we can help to educate you a bit and allow you to think a little bit. And always reach out to your medical professional before making any lifestyle changes. Thank you. Hey, everyone. We made it to March. Enjoy this episode brought to you by Health Code. GETHLTH.com. They're doing great stuff. They have a great berberine product that I love that I'm using with my patients. And it has turmeric and anti-inflammatories and all that for us to recover from our hard workouts. Hopefully we're still doing those in March. And also they have their great shakes. Of course, the chocolate macadamia is my favorite. Also, they have their creamy vanilla. They have a vegan option with fermented pea protein, which is their claim to fame right now. They've really reached a lot of people with that. It's expensive to make that, but they're taking a bite to make sure they get that product out to people. So anyways, thank you for listening. Patreon supporters especially, thank you. Greatly appreciate your support. It's less than 1% of the listeners, so we hope that a few more jump on board there so we pay our guys and not have to take another sponsor, hopefully. But again, thank you and happy 2025 to you. Keep up the good work.
Discover a new path to wellness at Arizona Metabolic Health. Dr. Brian Lenzkes offers advanced medicine and personalized care, treating the root causes of your health concerns, not just the symptoms. Whether you're seeking direct primary care, effective diabetes management, or medical weight loss, with a holistic approach, our team is here to guide you every step of the way. Visit ArizonaMetabolicHealth.com today to learn more about our innovative health solutions.
Hello and welcome back to the Life's Best Medicine podcast. I have an old friend here. You may have seen her around. She would see the Tony Hampton's podcast, and I don't know, you've been doing all kinds of stuff. So this is the area of medicine that for me is the most challenging. Dr. Salcedo, welcome. Dr. Andrea Salcedo.
Yeah, hi.
The conscious gynecology.
That's right. I have YouTube channel and all that, and so that's my big thing is to do metabolic health and as it relates to women, because a lot of times women believe that their periods or their pelvic pain or irregular periods, fibroids are all related to like a female hormone of like estrogen and progesterone. But if we look at root cause, which is kind of like what metabolic health really is, we find out that it's related to insulin resistance and hyperglycemia and all kinds of inflammation that we often overlook, but women know inherently they're experiencing. So my goal, with conscious gynecology is to look at all of the factors that really influence women and create the womanhood that they're kind of experiencing. And so that's what I do.
So let's step back. That's all awesome stuff, because I learned a lot from you already earlier. I mean, just hearing some of your talks, and you're active on YouTube, getting out there. And so first of all, how did you get into medicine? What drew you into this field?
Yeah, well, I am a second generation Mexican American. I kind of have like this immigrant family experience. My grandfather was a farm worker, and my mom was mostly a single mom, and we kind of just moved everywhere all the time. And so I didn't really have a whole lot of stability, but I remember how exciting it was to go to the doctor and just feel like someone was really caring for me in that way. And so I really don't remember when I didn't want to be a doctor. I always remember like my physicals and it being a lot of fun. And then I just started being interested in delivering babies because I thought, I mean, that is like the quintessential doctor thing, right? Is delivering babies. And I really wanted to expand on that. And so I went to Western University in Pomona. So I'm an osteopathic physician, and that's actually where I was living when I was younger, and I spent a lot of my time there. So I really started noticing a lot of the underrepresented, doctors. There's not a lot of people that look like me, and I really felt like I wanted to make a difference and influence in that way. And so, yeah, I became a physician, and I'm a board certified OBGYN. I work at Loma Linda University.
Awesome. Yeah. I did the OB-GYN rotation. I was like, at USC it was really nasty. Like people were,
Yeah.
it was a lot. I don't know if it was like in your residency programs, but man, it was so contentious. I was like, okay, I'm not going to this field. I decided because of that. Plus I was seeing everyone having to get up at 3 a.m. and deliver babies and running around. It's like, it's very romantic. And I remember the first time I was part of a delivery, it was like so awe-inspiring to see a new life. You're like, man, all potential. Like it's so amazing to, it's
Yes.
such an honor to be a part of that. So I can imagine, I mean, so how was that? Was the training rough? Like people sleep deprived and
Yes.
grumpy and all that?
Yeah, unfortunately, OBGYN has one of those reputations of being like the most challenging surgical field out there. It is really full scope. I see, clinic, and I have surgery, and then I deliver babies, and I do a lot of procedures and stuff. And that's a lot of really exciting, but it really does weigh on people. At that time, the doctors were working 80 to 100-hour weeks and in training. And when you think about when you're pushed at like your maximum, right? And you're really have like so little bandwidth to offer compassion and forgiveness and collaboration and teamwork. And really, when you're pushed that hard, it is sometimes comes out to other trainees and other doctors as like being edgy or mean and stuff, and that happens, but I actually am really blessed. I work at an amazing institution. It's Christian perspective, and so I think that really like brings doctors like in a way to really honor what they're doing and look at it as a vocation. And so we pray before our meetings, and we have a lot of really cool spirituality like interwoven in what we do. And so even though OBGYN residency was really hard and just kind of doing what I do as a attending physician there is challenging, I also think of it as like despite all of that, we're still really good people and we really care for each other. And I think it has to do with a lot of the spiritual aspects of just reminding ourselves constantly to offer compassion and love to our patients, but also our colleagues. So it was really good. It was really hard, but it's actually been a really great experience.
Yeah, it's so important because you could be that, some of these, young girls who are pregnant, they weren't expecting it. They're in a bad situation and you
Yeah.
can give them
Yeah.
compassion and help them through that step, right?
Oh yeah, every day, I actually was just thinking about that with my one of my medical students a couple of days ago, is that really every day as a gift to be able to work with some of these patients and with any patient really, but in their most critical time of their life, to me it's like just another day of surgery or delivering babies, but for them, it's like one of the most important times of their whole life. And so I always say like a quiet prayer to myself, like, hey, like, please make sure that I guide me so that I offer my very best to what the patient really needs. And like I'm not trying to like keep talking about God, but like it really does like help me guide, and I think that focus of whatever higher power that we believe in, like really helps keep us centered. And for me, that's just like what works to help me be a good doctor.
Yeah, same for me, and I think that's it. And it's funny. I'm glad you said that actually, because when I first started talking about faith, people say, "You're a doctor and you have faith. How can you possibly have faith?" And I was like, "Can you the
Yeah.
miracles of this hand and how it works?" And we know all the stuff that can go wrong, and it's a
Yes.
miracle that we're not falling apart every single day. Like you think one thing
Oh,
happens and you get
yeah.
one hormone too high and you die, and you get one,
Yes.
blood counts too low, you die. All those kind of things. You realize how much stuff can go wrong, and it's especially delivering babies. You have to be plugged in because it's such a high risk profession, and so,
Yeah.
uh, yeah, it's such a spiritual thing.
It is. It really is. And I just try to honor that moment and stuff and really just, try to take deep breaths and really try to get plugged in and clued in and look at my patients in the eye, right? Because I think what do they say like when you want to like, smack your kids, like instead of like getting really mad at them, like just look them in the eye, and then it really grounds you. Like I feel like I really exercise that my patients too. Is not that they want to, I want to mad at my patients, but sometimes like in the moment you can really just be running in one way or the other and your emotions can kind of get high. But if you really just quiet down and just share a moment and stare at your patient eye to eye and really look at what they're going through. Man, I think that is such good grounding experience, and it helps me become a really great doctor.
And you bring peace to the patient too, because they know you're
That's
connected
right.
with them and you're there. You know, a lot of patients I talk to, they'll tell me that their old doctor would have their back to them the whole time typing on the computer, right? And writing their notes while they're there. It's like, hello, am I here? Are you gonna look at me?
That's
Yeah, it's
that's
pretty wild how
right.
medicine's changed in those years. And I remember you know, in residency, being in med school, I'd be gone for, you know, 2 or 3 days sometimes, you know, and it does take a toll, especially like we were talking about having kids and being a female in medicine. The demands are so, uh, yeah, they don't just stop at the end of the day. You have to go home and
That's
helping
right.
and, you know, baths and story time and all that.
Yeah, I think that's a lot of truth, and it's something that my husband and I really try to be aware of every day. I love cooking for my kids. I love cooking for my family. I think mealtime is like a huge thing in my house. We are very low carb leaning, even like keto or carnivore even leaning. But, I think that I just want my kids to be good citizens. I want them to have and understand what mealtime really means, and sharing and cultivating relationships and having interesting conversations. But I think that really slows us down. And so, when I'm working, it's like, 7 to 5 p.m. and then I like rush home. But as soon as I get home, I'm mom, right? And so then I'm like, what are we making for dinner? And we spend a lot of time making dinner together, and then we sit down at the table and nightly. And I think that's really important because it just slows down the family. But when you're high functioning and you have a lot of goals, it can feel like, man, I also want to cultivate my podcast, my YouTube channel, my side gig, or do the research and stuff. And so it's hard, but I'm really trying to put forth a good marriage and a good family. My kids are like extremely important to me, and I have 3 boys, right? And so like I want them to feel and understand also like the impact and the struggles that women go through. And so we talk about, delivering babies, we talk about tough surgeries, we talk about the experience of women, and so I want them to have a really good lens to understand and see the world. And so, yeah, I think it starts with dinner. It starts with making good food. And when you make good food, it's good and it brings a lot of balance to our family.
Yeah, and just having that time and ask him how life is, what's going on, how was school, you know, those
How
kind
was
of things.
school?
What are you
Yep.
struggling with?
Hmm.
Yeah, it's funny because I have 2 daughters. You have 3 sons. I have 2 daughters, and it was, you know, my daughters would come to me and ask me questions about their periods and all these different things because they knew I was a doctor and we're very close. And it was funny. My wife was laughing like, I would never talk to my dad about that. Never, ever. It
Yes.
wouldn't even come up.
Yes.
But it's funny how times have changed, and you know the importance of for sons having a mom that to know how to treat someone and what they're looking for when they get older, all those kind of things, you know, the respect
Yeah.
level.
Oh yeah, it's so much fun talking about puberty with him because they're not like embarrassed or afraid, like actually like my middle child like is starting to get body odor. And so he's like, "Mom,"
He's like,
like
thanks, mom. Thanks for
I
telling
know,
everyone.
and
Appreciate
he's
it on
like,
the
I
podcast.
know, right? And so he's like, "Mom," and we were laughing because I'm like, "Oh, good, you get to use like deodorant," and it's like a rite of passage, right? And
Yeah.
so these little things, and where man, like just the same thing. Like I would never really talk to like my family or my parents like about like these milestones, and but it's because it was kind of embarrassing, right? But like it's kind of breaking through the silence of talking freely so that they can really feel like later they can talk to you about anything, right?
Yeah. When they feel
That's the
comfortable
goal,
and they
right?
have
Is
your
that does
back.
that what
Yeah.
happens? Is that what happens when they get to their 20s?
Yes, it happens still, believe it or not. My kids still ask me for advice and talk to me. And it's so great that they
Yeah.
respect us that much, you know? And so a lot of people, if you're listening, yeah, they say when your kids go through teen years, they're going to turn against you and be, you know, brats and all that. Like, it never happened. Like, I think it's such a, like, we expect those things. And I kind of expected it, like, to get, but I think when you set those rules when they're young and you go, okay, look, I'm going to look you in the eye and I'm going to tell you, here's how it is, right?
Yes.
Don't test me on this
Yes.
thing, right? Trust me on this. So
Yes.
yeah, it was really good because it was funny because like when the kids were little, it was so funny because we'd ask them to do something, they wouldn't do it, and we go, okay, one, we used to go 1, 2, we never got to 3 ever. Like we was 2, and they're like, okay, we'll do it. And they
Yes.
run. And
Yes.
so my
Yes.
wife's like,
Yes.
what would we do if we got to 3? I'm like, I don't know, but we never had to. Never got there. Just start counting, everyone. It seems to work pretty good. Yeah. So
Yeah.
so as far as from the gynecologic standpoint, like keto, low carb, how did you start looking at that? How did you connect those two things?
Yeah, so it happened with, after I had my second child. So my second child, I ended up having gestational diabetes, and that was, like, really surprising because, I was 120 pounds when I was 24 weeks pregnant, but my glucose test was 197, right? And so it was like, wow, like, how is that possible? I was super thin and I was a little older, like probably 36, 37, but outside of that, I didn't really appear to be someone who had gestational diabetes, right? My colleagues were all surprised and baffled. I didn't even go through the Sweet Success, like, gestational diabetes education because everyone just thought I knew, and so I wasn't even referred, and so I was just trying to do it on my own and trying to check my blood sugars, and I was noticing that, like, any carb would make my blood sugar go up. I mean, like, it was Mother's Day one time, and I just wanted, like, a little pancake, like, I just wanted to have, like, brunch and, like, a little pancake, and so I had, like, this sliver of a little pancake, and my sugar went to like 170, and I'm like, man, like, I couldn't even have that, right? And so
Yeah.
eventually I just started eliminating carbs altogether, and I started realizing that there was very little guidance for women on how to get through gestational diabetes. And so I had my baby and everything went fine, and he was like 7 pounds, and it was a really, easy delivery. But it was during the postpartum period where I really started trying to figure out, like, what's going on here, and so I started reading and I found the Nutrition Network, and I actually saw one of your videos too in the early days of Nutrition Network where all of those trainings and stuff, and I just started taking all these trainings and learning about end organ damage and hyperinsulinemia and inflammation. I thought, wait a second, if we're talking about hyperinsulinemia and inflammation, endothelial inflammation, and if that is causing effects to all these other organs like the kidneys and the liver and the heart, then, like, what is it doing to the uterus, which is like one big smooth muscle, and that is the same muscle that lines all of our blood vessels, right? And so then I started thinking, is our uterine fibroids really just atherosclerotic disease of the uterus? Is that a sign of impending cardiovascular disease risk? And then I just started looking at old literature like 60s and 70s from these pathologists, and they had already started to know. We knew this in the 60s, that the same cells that cause uterine fibroids were the same ones that cause atherosclerotic disease. It was incredible. But what happened is that also in the 60s is when we started using birth control pills, right? And it's not that birth control pills are a bad thing, it's just that they're really good at decreasing the bleeding as it comes from all these inflammatory disorders related to gynecologic disease. And so then we just started running with, like, a lot of the pharmacology as treatment, right? And then as technology started advancing, then there's, like, all kinds of really great devices for, like, hysterectomy and, like, myomectomy and all these great things that are really helpful, but they don't really get to, like, the root cause of, like, why a lot of these disorders start to come. And so it became like a huge passion project, and really, like, I just started, producing literature and, like, doing clinical investigations, and then just started becoming an advocate for really the root cause, because even gynecologists unfortunately don't always understand why these gynecologic disorders happen. We have lots of guidelines of how to treat it, right? But a lot of us are so busy, or, I mean, we just talked about the demands of an OBGYN, that we don't really have a lot of time to go back and look at the literature and the textbooks that actually describe all of these pathophysiology. A lot of us are just really want to take good care of our patients. And so it's like, okay, what are your options, right? We got medications and surgery, right? And so a hysterectomy is really good at controlling bleeding, right? A birth control pills and the IUD are really good at that. But when I started to kind of understand and grow through my practice, I realized that probably 50% of my patients were incredibly discouraged when they left my office, because that's all I was offering them was medications and surgery. But, like, whenever they would ask me why these things would happen, and all I had to say was like, "Oh, it's probably your genes," and that's kind of like what everyone says. And
Bad luck.
bad
luck
luck
genes, right?
genes,
Blame it
right?
on your
And
mom and dad.
oh yeah, and like genes are like the lowest, risk factor when it comes from all these other gynecologic problems. And so it really started to show me that this was an understudied area of medicine. And now it's just become really what it gives me passion and what helps me get through these long 24-hour calls about, when I am working as an obstetrician and stuff. It's amazing. So it's become something that I really want to focus and shed light on.
Yeah, it's amazing, and you shed light on me because, endometriosis, that's been an ongoing thing. And you said, well, that's metabolic. I'm like, endometriosis, oh my gosh, because that's the one for women who have really painful periods and like they'll have scar tissue outside in their abdomen. So they're doing surgery all the time on this. And then they get scarring and then they have worse. And it's like, it turns out like, how do you fix this problem, right? Maybe you could
Yeah,
address
and
that a
that's
little bit.
exciting. Yeah. Well, I'm going to actually be speaking on that at our low carb conference in Boca Raton in January. So if you're interested, definitely come and check it out. We're actually having one full Women's Health Day in Boca through the Society of Metabolic Health. So check it out. But yes, endometriosis is actually one of the most frustrating gynecologic diagnoses out there for the patient and for the doctor, because the patient, it takes them a good 5 to 7 years to actually obtain a diagnosis. And then once they do, most of them aren't really satisfied with their treatment because it usually involves some sort of birth control pill, some sort of either shutting down their cycle and turning them into menopause, or surgery, right? But like the thing about endometriosis is that it's progressive. And so if you don't focus on the inflammatory trigger, then it'll just keep progressing. And so that's been really exciting. And so that's another area of my research, is that what we know about endometriosis is that 10% of women have it, but what it's caused from is something called retrograde menstruation. And while everyone has retrograde menstruation, it's actually inflammatory gut dysbiosis, or like a imbalance of the good bacteria in your intestines that causes this leakage of this inflammation down into your pelvis. And then when you have your menstrual cycle and the menstrual cells go through the fallopian tubes, they actually cause new blood connections within your peritoneal cavity, your pelvic cavity. And then those cells bleed just like any other cells in the lining of the uterus. And it's just every month it happens that way. And that theory came out probably about 7 years ago, and it hasn't gotten a lot of press in terms of other doctors understanding that. I think at that time, 7 years ago, there was like 5 articles about how the gut microbiome is the real root cause of endometriosis, and now there's probably about 300 articles, out there. And so there's so much room for research. So yeah, endometriosis is actually inflammatory disorder related to gut disturbances. It's fascinating.
Really interesting. So I would think there would be a higher proportion of women struggling with diabetes and metabolic disease getting these kind of things.
Oh, yes, that's absolutely true. It's actually endometriosis is an independent risk factor for cardiovascular disease, hypertension, diabetes. So for sure, even when you took out like diet, whether they're obese, whether they are smokers, it's totally independent risk factor.
So do you see women doing ketogenic diet or a low carb diet, and their endometriosis gets better just through lifestyle change?
They do. And it's really fascinating. And I was doing that for a long time. And then I started learning more and more about what the gut microbiome really needs, right? Because we all know that processed food will damage the gut microbiome. But what actually, if you take it a step further, it's mostly like what we need to do is feed the gut microbiome, right? And so vitamin A is a prebiotic for the bacteria in the gut microbiome. And so a diet rich in vitamin A, and which when we were cavemen, remember when we were cavemen, we used to sacrifice an animal and we would eat nose to tail, right? Well, part of that were a lot of the organs that an animal have, like the liver, right? And so the liver is a huge source of vitamin A. So, remember back when your grandparents would say eat liver and onions and stuff like once or twice a week. And the reason why is because it feeds your gut microbiome and it helps keep the immune system stable in your intestines, right? But if we don't eat that, then we're already going to be deficient. Now, I'm not suggesting that everyone go out and eat, or liver, but it is something that we used to do for thousands of years and we don't do it anymore. And so one of the really great things that I always tell patients with endo to eat is cod liver oil, because cod liver oil, it has omegas, it has vitamin E and D and vitamin A. And it's kind of like transformed my practice when I put people on cod liver oil with a well-formulated ketogenic diet. They do fantastic. It's like kind of like magic.
Yeah, it's
And so
amazing.
it's amazing. It's amazing.
And the other ones, PCOS comes to mind, polycystic ovary disease, infertility, all these things. Like the joke with Jason Fung was when they get people metabolically healthier, the biggest side effect was pregnancy.
Was pregnancy. That's absolutely right. I mean, that's like the gateway drug, almost honestly. Like when folks already have PCOS when they're really, really young, it's all of a sudden it's just going to open up a can of worms of all these problems that will eventually occur for them. But yes, hyperinsulinemia, high inflammatory markers, those are big time PCOS indicators. And really, it's such a biologic adaptation, right? If we think, because I'm always wondering, like, why did our body choose to do this? Like, why is it going in this direction if we have hyperinsulinemia? Well, when for if you think about the biologic requirements that are demanded of a woman to have a baby, right? It's like easily 1 year being pregnant and then 2 years of like active child rearing, right? If you have a 3 year huge commitment of your body and your life, your brain, your reptilian brain, is going to be constantly monitoring things to make sure that you don't get pregnant at a time that's not right for you, right? Whether your frontal brain, your executive functioning realizes this or not. And because a lot of patients come in to see me and they're like, I'm doing fine, but they're like crazy high functioning people with all these obligations and their period starts to get messed up. Or they're if they are like in finals week and they skip a period, or there's like a death in the family, they skip a period. Women inherently understand that, or like, oh, I was really stressed out, I skipped my period, right? Well, there's a biologic adaptation for that, and that's because if your insulin level's really high from stress, then it's actually going to block the ovulation factors in your brain to prevent you from getting pregnant at a time that's not right. And so stress raises insulin, but also carbohydrates raise insulin, right? The big one, right? And they're so plentiful here in our society that both of them can impact and cause PCOS symptoms. It's fascinating. And when you teach women that physiology, then it just totally makes sense, and they're more willing to kind of understand and do the lifestyle and the diet changes to help bring that insulin level down. And yes, the side effect is pregnancy.
Yeah, the other thing is, I had to look up the term because I knew you'd correct me on it, but macrosomia, like these babies are born so huge now because mom is so insulin resistant that the babies can be born insulin resistant. Maybe you can address
Oh
that a little bit.
yes, there's so much biologic programming that happens in utero, and a lot of things. This is really exciting. So I've been really into a lot of evolutionary biology recently, and I think a lot of the interesting things that come from, particularly first trimester nausea, vomiting, right? And it's like, why did we have nausea, vomiting in pregnancy? Like, what's that about? Well, if you think about it, a woman's body is just trying to protect it from things that might be a negative exposure to the fetus, right? And so in that first trimester, um, for thousands of years, like, we were not able to refrigerate meat, right? And so it wasn't until like the refrigerator came out like 70 years ago that we were able to preserve and store meat. But meat was like a huge, huge source of food poisoning, right? And so a lot of times when women are in their first trimester, they feel like they can't eat meat or anything roasted because it makes them want to throw up, right? Well, the roasted piece also comes from like whenever you roast an animal, there's char on the meat, right? Well, char is like a huge source of carcinogens, right? So food poisoning and the charring of meat really cause this adaptation of food aversion for pregnant women in that first trimester. The other piece is certain fruits and vegetables and legumes that have lectins, because lectins are anti-nutrients. And a lot of vegetables cause a lot of metabolic dysregulation in the formation of DNA. And so a lot of women just don't really want to eat, and they just want to drink like water and juice and those kinds of things like that will help them with their hydration. Well, here's the important thing is that in the first trimester, the baby's pancreas hasn't formed yet. Okay. And so it really relies on mom to keep normal glycemia so that it doesn't flood the baby with high glucose. Okay. And actually, the major food source for the baby in the first trimester is ketones. Okay. And so it body really needs those ketones to help with the baby's brain development and support in that first trimester. So if you're not interested in eating, it's okay. Okay. But a lot of patients, particularly carnivore leaning women, get really frustrated because they've fallen off the bandwagon in that first trimester. It's biologic. It's okay. It's going to get better after the second. But yes, and then when if you flood the system in that first trimester with sugar, then it's going to cause inflammation at the level of like the fetal neurons and stuff. And there's a lot of really interesting associations that we see with women who have diabetes, pregestational diabetes, and autism, and all these strange things that happen, and type 1 diabetes and metabolic dysregulation in the fetus and the neonate when it's born. And so when you think about gestational diabetes, it's actually a physiologic phenomenon mostly of modern living, because there is supposed to be insulin resistance when a baby is developing, and that's because eventually the mom is going to need to give all of those carbohydrates to the baby through breastfeeding, right? So it's a long adaptation that happens, but in modern society we eat way more carbohydrates than what we used to eat 50 years ago and stuff, and our bodies just haven't caught up with all these thousands of years of biologic adaptation and evolution. And so, yes, when we eat all that, then all those carbohydrates go straight to the baby and the baby can't handle it. And so it starts to grow. And so then you get these like really chubby babies and wide abdomen. And that really is a function of the swelling of the liver. And so then we get all these problems, and those kids are way more at risk when they are older of getting metabolic dysregulation. It's fascinating. So we really have to be careful and kind of just go with what feels right when we're pregnant.
Yeah, and more complications with childbirth too for the
Oh,
baby
for sure. That's not
physically trying
even
to
talking
pass
about
through.
the
Yeah,
childbirth,
that's
right? It's like,
that's
oh,
the other
we
thing.
can go
More
on and on.
C-sections are done
More
because it's like
C-sections,
yeah,
yep.
yeah.
The baby birth trauma, the baby gets stuck, all these things. And then of course the mom gets more unhealthy and is unable to push through the baby. It's there's so many complications. It's incredible.
And it's amazing because so many times I hear people like, yeah, women will come to me, they have PCOS, and the doctor may start them on metformin. But I go, do they ever talk to you about diet at all? No,
Yep.
never say anything.
Yep.
Well, you're taking metformin to lower your insulin to get more insulin sensitive, right? And then the other one that was interesting and this is back before I really um, understood it, I was like, this is the dumbest thing. But there were studies showing that women with fibromyalgia would get better on metformin. I go, that's dumb. That's a diabetes medicine. It has nothing to do with that. And they go, oh, if you have really high insulin levels, you're more likely to have inflammation and achiness and pain. And you say, oh, you fix that and the joints get better and everything gets better, right? So it's really interesting
Yeah.
how we do stuff and we don't even know why we're doing it sometimes. And when you understand the
Right.
physiology, you say, oh, okay, it makes sense, right?
Oh yeah, no, it goes into so many different directions, like endometriosis, uterine fibroids, irregular periods, heavy periods, all of these things, pregnancy, preeclampsia, right? Like preeclampsia and all these placental disorders that have to do with inflammation that's circulating in the vessels. And so internists and family medicine doctors understand the concept of pathologic neovascularization, right? So which means that like the blood vessels that are regenerating in the eye and the kidneys and stuff, they're never the same when they're exposed to high levels of glucose and inflammation. Well, what is the ultimate neovascular event that happens for women? The placenta, when the placenta is growing, right? And so when the placenta is growing into the lining of the uterus, if it's under experiencing the environment of inflammation, then those blood vessels will never implant as how they should. And after about 25, 30 weeks of pregnancy, those blood vessels become really strained. And then it develops into preeclampsia, gestational hypertension. It's fascinating, but we know at these big studies, when we go to these big, ACOG meetings, preeclampsia is an independent risk factor for cardiovascular disease. So it's like, okay, but why, right? And I think you and I in this space totally understand it, but then we're trying to find the gene, and then we're trying to blockade the gene, and that causes all this stuff. Yeah, we know all the genes, and the gene therapy is really exciting, but if you take away the exposure, then you don't have to activate the gene.
And
So it's
that's the amazing thing I've learned in medicine. It's so funny because I'll talk to cardiologists and I'll say all diabetics have to be on a statin. Why? Well, because they're at increased risk of cardiovascular disease. Why? Why? We don't know.
why.
They just are. Well, I think we know the endothelium gets damaged by high sugar, high insulin, all these
Yeah.
toxins, metabolic disease, and so it's funny because there's a you can't see this somehow. I don't understand it, but they can't look at the data on insulin and endothelial dysfunction, which is exactly what you're seeing in the uterus. Also, we're
Yeah.
also seeing in
Yeah.
the brain with depression, anxiety, and Alzheimer's disease and all these other. So when you start stepping back, that's why these conferences are so amazing to go to, the Low Carb USA and the Society of Metabolic Health, is you say, oh my gosh, all these specialists, oncologists are talking about it, gynecologists. You were the first gynecologist I heard talking about it, neurologists talking about it. Every area of medicine, you go, oh my gosh, it's pretty amazing
Yes.
that all these things are so interconnected.
Oh, yes, and then you feel like a broken record, right? Especially in your, like, patients, but among your colleagues, you're like, "Oh, yeah, I know what that's, from, or I know what the root cause of this, and have you ever thought about ketogenic diet?" Or and it's like, man, it's like the same answer all the time. I feel like there's nothing smart I'm offering anymore, right? It's kind of this one
Like it's
size
the same
fits
answer.
all. It's the
Sorry.
same answer, sorry.
Yeah, it is pretty amazing though when you look at it. Then you could go to the other extreme, right? So some women are trying to lose weight, so they'll be fasting around their period time, and that's a signal to your body, don't get pregnant because you don't have food abundance because you're going to need food to help this baby, right?
It's really funny because I think that's what like Mindy Peltz. Like I'm actually like finishing. I just read her book. It's pretty cool. That's called Fast Like a Girl. And for a long time, I think we had this one size fits all approach from Jason about, oh yeah, just fasting and everyone's doing really well. And then, but women started having a little bit of spotting in between periods, or they're not really losing weight that's like they should because they're fasting during what we call luteal phase. And luteal phase is that week before your period when the ovulation happens, right? Well, exactly what you said is that, like, if your body's feeling like it's under stress, right, the hormesis that's involved with, like, regenerating and things like that, the body repair from extended fast doesn't really apply in this spot because, for better or for worse, women were kind of made to have babies, right? And so your body constantly is just like sensing, are we under a stress, right? And so if we're fasting too much or too long during that luteal phase of our menstrual cycle, then yes, we're going to have a hard time getting pregnant, or yes, like, maybe we won't be losing weight as quickly as we should. And so really paying attention to a lot of what's going on in our life is really significant for women. It's not like a one size fits all approach.
And now we step into the older ladies, like going through the perimenopausal, menopausal state with hormone replacement. There's been so much controversy over that also. How can we help women out
Yeah.
at that stage of life?
Well, I think if we teach women where they are and understand, like, the big transitions in our life are all related to insulin resistance. So puberty and lactation and pregnancy, but also menopause are all big transitions in our lives that come with insulin resistance. Well, what happens in the menopause transition is that the declining estrogen actually reformulates the location of adipose tissue in our body. And so it changes the position of the adipose tissue from, like, our hips and our thighs to our abdomen. And every person in perimenopause and menopause will tell you that they just can't get rid of this belly fat. Well, that has to do with the declining estrogen, and it changes the adipose position and it goes into our viscera. Well, our visceral adiposity is like way more inflammatory than our peripheral. And so that is one of the big reasons why the women, when they go through the menopause transition, have the same cardiovascular disease risk as that of a man when they complete the transition, because that has happened. And so really, a low carb diet is really, really important, to basically be in line with what our new physiology is of, having this insulin resistance. So then that means that we don't need as many carbs as we used to, because we're not trying to, like, get good body weight for having a baby and stuff. And now it's like this new womanhood of offering wisdom to the younger generations. And so the really interesting thing is that a lot of the symptoms that women go through in menopause, hot flashes and nighttime wakening and all that, are actually the same things that a lot of us went through when we breastfed, because breastfeeding is a hypoestrogenic state also. It's a low estrogen state. And so we need that low estrogen and the changes that happen in our brain, nighttime awakening, hot flashes, to actually care for the baby. And so there's a lot of interest in biology, evolutionary biology, of that the hot flash in the lactational periods actually to help radiant warming for the baby. And so is it that maybe when we're in menopause now, we are this new, these older women, these like that bring wisdom and assistance to like our community of women who are experiencing childbirth and the postpartum period? It's fascinating, right? So
It's
yeah,
almost as if we have a creator who understood all this stuff.
I
Huh.
know, right? Like it's
Isn't
just
that amazing? I never even thought about it from that standpoint.
amazing,
Because I remember my
right?
wife, when we were younger, she would like the mail truck, everything would go by. She would never wake up. She was out, out, out. Nothing would wake her. Alarm. She'd sleep through her alarm. I go, she's never gonna wake up for the baby. She like the baby makes any little peep up wake. Right? It's amazing how the brain changes that much. Like any little
Yes,
sound, she
it's
hears it.
oh yeah. And so then there's a lot of really interesting literature, evolutionary biology literature, that looks at, is that the menopause symptoms useful to the younger generation of the when we used to live in communal settings, you know? And yes, it is, right? So we can help women, when young mothers, you know, go through their own phases of life, and help them so that they're not alone, right? Because that's what brings about so much postpartum depression, is that when you're doing it all by yourself, when you feel that those loneliness feelings, and your community is not with you to support you. And so yeah, that's all related. It's like this, the creator just knew.
Yeah, and oxytocin, right? Bonding with your baby, bonding with other people, being in a good place. And
Yes.
I think a lot of us are missing that peace we need, being at peace, stressful job, stressful marriage, things are conflict all the
Yeah.
time. And it's telling your body, you know what, store fat because bad times are coming because you shouldn't be stressed
Yep.
like this. So
Yep.
many, and especially I want to make that point when being a young physician, like the pressure's on you. You go, okay, I have to find the time to shut my sympathetic nervous system down, right? Find this
Yes.
calming, whether it's breathing, prayer, meditation, connecting with the patient, whatever it is, that we need those feel good stuff, and we can't be putting ourselves in conflict all the time.
Oh yeah. And I think it's like, you know, that fight or flight nervous system and the trauma response too. A lot of doctors like really are a little surprised by that, because we experience a lot of difficulties in what we see in the hospital and clinic and things, and that really we become what we call second victims, right? Because we do carry a lot of the burden of what our patients are experiencing. We don't truly want our patients to have bad outcomes, but sometimes things happen without outside of our control. And then that is exceedingly scary for us physicians, because we work so hard. I mean, I know a lot of patients get frustrated with physicians, and, you know, maybe we're not what they want us to be, you know, but truly doctors went into this field with, you know, 10, 12, 14 years plus of training to really help people, you know. And so when doctors experience burnout or trauma, all those, that flooding of catecholamines, right? That flooding of adrenaline, and that really raises like our blood pressure and causes us to have all these metabolic problems. And then we have all of a sudden, like what happens, right? When we're under such survival mode, then we just have complete disinterest in what we're doing, right? Because our body is just so full of exhaustion. And
Burnout.
in this, when you're in survival mode, you can't take care of anybody else, right? And so the burnout is real. We've had, you know, I know Brian, you and I have had a lot of conversations about burnout with doctors, and serious concerns about what's happening in our physician community.
Yeah, and it's getting worse. It's not getting better, But it's funny because when
No.
I'm around DPC docs, they're like this. They're laughing, they're smiling, they're enjoying life, and they're like, "Oh my gosh!" Like because they realize, like when
Yeah.
you get out of the fire, you go, "Oh, I'm not in the fire every day." But it's those
Yeah.
memories of just being. I was just talking to someone. We were just talking. As a matter of fact, it was funny last night. I was almost embarrassed. We had a neighborhood get together. Like we all like it was Halloween last night, so we don't go trick or treating, obviously. So all the neighbors get together and we talk about how life is and all that. And a new neighbor came up and we met, and my wife said, "Oh yeah, he's a doc." She was like, "Oh my gosh, thank you for all you do." And I was laughing because I'm thinking, where have you been the last 4 years? Because like I think we're the least respected profession around now, right? In a lot
Oh
of ways. And
yeah.
it was amazing
Yeah.
because I was almost in bed. It was like a funny thing. I was like, "Really? Are you serious right now?" She goes, "No, no, seriously, doctors like they sacrifice." So she had doctors in her family, so she knew like what we go
Yeah.
through, But I think a lot of people
Yeah.
look, and I get it, a lot of people, and I think it's important to say this is that a lot of these doctors are so beaten down by the system that they just don't know. Like they're not happy. They don't know why. They're struggling at home. Their relationships are hurting. They're not seeing their friends. They're not going out and doing things because when you're working 16 or 18-hour days every day, you're exhausted and you
I'm
can't think about these
exhausted.
things. And you go, oh gosh, I got to go spend time with my mother-in-law, whatever, you know what I mean? Because you don't have time, and time's a precious commodity.
Hmm. Oh, it
Yeah.
is.
So
It's the only thing that we all have, and I think that's also like it's where relaxation and time is what brings curious and independent and creative thought, right? Where you can think outside the box. And really, if it wasn't for the almost forced relaxation of postpartum period and the couple of months that I took afterwards to really just replenish my soul and rest, and was when I was able to think independently about what is really happening to women in our metabolic health and the root cause of gynecologic disease. And I just thank God all the time for that time that I had to rest and really think. And so I really try to program times in my week just to rest so that I have the bandwidth to think and to explore new research thought and to help my patients and be good doctors for them. And so,
yeah, to be
but it's
compassionate
hard,
and kind.
and to be
Yeah, if you're on
compassionate and
edge and you're
kind.
stressed and not sleeping, not a good time. Hungry, grumpy, all that. Like I don't want to hear your
Yeah,
problems. I got other problems at home. You know what I mean?
yeah,
Yeah.
yeah, yeah,
Yeah,
yeah,
but that's a prevailing thing, for sure. But I love what
yeah.
you're doing. So tell people, like, if people want to track you down, how do they find you? And also like tell people what you're doing now with part of your time now.
Yeah, that's great. Thank you for that. I actually am. I'm a regular full scope OBGYN at Loma Linda University Health. So if you're in California, I'm in Southern California, I'm happy to see you. You look me up at the on their website and stuff, and that's where I provide the majority of like traditional gynecologic care and OBGYN care. But if you're looking for something a little different, I actually had a lot of folks that were trying to see me and really allow me to spend a lot of time and look at all of their inflammatory risk factors and triggers. I actually created a side gig practice. It's an online telehealth metabolic gynecology practice for folks that are in California, but also in Florida. So if your 2 feet are in Florida or in California, I can have a telehealth metabolic consultation with you to look at perhaps why you're struggling with infertility or PCOS or uterine fibroids or endometriosis or menopause transition. And so, yeah, it's consciousgynecology.com, and you can make an appointment with me that way. And we can really just try to work with what is going on with you and consult with your regular doctors and provide really great consultative advice to help your gynecologic concerns. So thank you for that.
Yeah, I think it's so important, right? Because look, if you're listening and you're thinking, oh, I need in vitro fertilization, I need this, all these procedures and surgeries and all that stuff, it's worth giving a call and say, hey, is this legit? Is this something I should do? What's your opinion on this? What's your experience? And so having someone who understands the root cause, because most doctors are going to say, let's fix that, if your appendix is hurting you, let's go and take the appendix out or whatever it is. And so having someone say, oh, have you tried this? Have you tried doing this little different approach to get your hormones right, stress levels, sleep, all this stuff we're talking about. And the crazy thing is, and it's so amazing, I still laugh about it. I have to get the footage, but for Fat Fiction, the movie, I had 5 patients up there and they all talked about their mood getting better. The movie was about reversing diabetes through lifestyle, but all their moods got better and their depression, anxiety. I was like, oh my gosh, it was like I was crying because it was amazing. Because they're like, yeah, it's great, my diabetes is gone, but I'm laughing again and I'm enjoying life. And so many women are going through these depression, anxiety, hormonal issues, and just reaching out to the right doctor who can help you. It's a huge, it's an important thing.
Oh, yeah. Thank you for that. It's such a good, I really appreciate your understanding how much it impacts women. And, a lot of folks wonder, like, do I accept insurance, like in my psychic practice? And I really don't, because really I want folks that are interested in that investment. And it's a very small investment for the bang for your buck, right? Like if you're thinking about IVF and like it's like $15,000 right now, or a surgery or like your deductible for surgery or things like that. I think that a small investment in someone and a doctor who's really willing to spend their time with you. I mean, look at what you're doing every day, direct primary care. It's a leap, right? It's like this leap of faith, of courage, that doctors are like, no, my time is very important. I have so much great information to share. And it's the select patient who's willing to create that investment. And then it's all of a sudden this like wonderful relationship of like, oh my gosh, I'm so excited. I'm willing to make this work, and I'm going to do, all the recommendations. And all of a sudden you just see like fireworks of like people's moods getting better and they're feeling great. And then they're enjoying life's best medicine, aren't they? Right.
Yeah, then you have your life back. You can go exercise and be active and have your energy. Like so many, I notice it all the time. These young women would come and go, "Oh my gosh, I'm just exhausted all the time. I'm always tired. Why am I so tired all the time?" And we're checking their thyroid. Back then, I didn't know about insulin, but now when I see the insulin, I go, "Your insulin, you're super insulin resistant, right?" Maybe that's part of it. Let's get that figured. You get that insulin down. They go, "Oh, I have energy." Now they can get to their fat stores and they can, not be starving all day long. It's amazing to see. And then it's almost frustrating because you go, "How many years did I suffer when I didn't have to?"
I know, it's amazing, and I just really appreciate these times too, like, collaborating with doctors like yourself, and when we see each other at these conferences and stuff, it's really invigorating and inspiring. And so, I'm so glad that you're doing what you're doing, and you're definitely a pioneer for all of us. And I just hope to, like, use your example to kinda continue to do what I'm doing, and hopefully create my own private practice in the telehealth way to kind of make that like the major modality of what I'm doing to try to help women. So thank you so much, Brian.
No, thanks for joining me. And I think that's an important point is that, just being able to help people and do what we're called to do and not just do surgeries and all these things. And I think the big thing is letting people know you're available when they go, "Oh my gosh, I never thought about that. Maybe I can have," because so many women are crippled by period pain and mood disorders and all of these things, and having someone who can say, "Oh, these are all related. Let's try this and see what we can do. Let's pull whatever lever will work." And then having, for on your part, having a willing patient goes, "Look, I want to get better." They're invested.
Yep.
They're going to do what you say.
Yep.
Because a lot of people are like, "Yeah, just give me a pill." They're not the right patient for us.
Hmm.
I mean, you think
Right.
about it.
And that's okay, right? Like whenever I talk to patients about what, particularly in my traditional medical practice, like it's like there's lifestyle, there's medication, and there's surgery, right? Like, and so what are you up for, right? And so then they get to decide, because maybe some of them are on food stamps and they can't do a well formulated like ketogenic diet, or maybe they're like in the middle of a crisis in their life and they can't do a lot of lifestyle stuff. And so
Sure.
maybe a little bit of medication helps bridge them, and that's totally cool, right? Or maybe like, I don't know, no amount of like low carb dieting is going to make a 10 centimeter fibroid go away, and so then that's where surgery comes from. But if we don't teach people how they got there, then they're just not going to get better. Then they're just going to have surgery and then move on with their life, and it's just one
Then have
less
it come
patient
back
for the
again.
gynecologist, right? Or
Yeah,
yeah.
yeah, yeah.
And and
Yeah,
so
you don't want to be a lifelong patient all the time. Get good advice, get on
no,
the right track, and say, "Okay, I'll see you next year. We'll see you in a couple of years, whatever."
that's right. That's like the model for my practice and my metabolic health practice, is that like I do 1 or 2 visits with them, and it's like, well, you can't unlearn what I just taught you, so I'll see you in a year,
Yeah,
and it really just flies by themselves. It's really great.
yeah. And some people may need more support and more hand holding. Like, look, let me meet every month until I get on track. Let me get the training wheels off and all that. So
Yeah.
that's us all working together and figuring that out. So I'm so glad you're doing what you're doing. And now I've got to
Thank
ask you,
you.
what's life's best medicine for you? Like, what what
Oh,
what really matters? What would you tell your patients or your family? Go, look, here's the important stuff.
yeah, honestly, the important stuff is just slowing down and stopping, and really just pausing and thinking about what you're grateful for in your life. And I think gratitude is really life's best medicine, because if you pause for a moment and have a moment of gratitude for whatever could be going on in your life, right? Then you're really picking out the gifts that were given to you. And then it makes the small amounts of suffering or big amounts of suffering that you're going through way more manageable, and it brings meaning, right? Because if we're experiencing suffering, there's probably a reason for that, so that maybe we can be a beacon of hope for someone else who is experiencing that suffering later. But those moments of gratitude, I think that's life's best medicine. So,
Awesome stuff. Always great seeing you. We got to do this more
thank
often.
you.
We'll do a catch up when you have your new breakthroughs. You let me know, and we'll do another podcast, because I think it's such an important. Women's health is so overlooked, because most of the studies are done with men, and the guys just don't understand. So it's so great to have, all these different things, and what we learn from you, we can apply to other areas of medicine, and it's just amazing what we're doing. So everyone, this is gold level stuff. I would say, be kind to yourself, be kind to others. Take some vitamin G today, take some gratitude. Even if you're going through a hard time, count your blessings, look at your faith, look at what really matters. And someone else always has it worse than you. So just kind of count your blessings. If you're sleeping under a roof, or you got your shoes, whatever it is, just be appreciative of what you got, because a lot of us have been from a third world country, or are from there, or have been there, and you realize, like, we've got it pretty dang good despite our complaints.
That's right.
Thanks, Doc.
Well,
have a great weekend.
Yeah.
Thanks so much for joining me. I appreciate it.
My pleasure. Thanks so much.
Thank you for listening to this episode. We greatly appreciate your support. We would greatly appreciate a positive thumbs up on all of the platforms like iTunes and Spotify, or wherever you're listening. And we just thank you for our Patreon supporters. We greatly appreciate your help in getting this message out. We think there's a lot of important information, and hopefully this helps you. Have a great day, and thank you for listening, and thank you for your support.